Mr. Williams, and good evening to all who are listening and watching via the various media means. Today I want to use a comparative narrative to be able to give my briefing. Now, you would have heard the discussion on vaccine, and that's the stage where we are at right now, vaccination. We have been talking about vaccines for a good while now. How do we reach the ending of this pandemic? Or how do we end this pandemic? Now, I want to focus today on two critical countries. That's the UK and the United States of America, because these are the two source markets for our tourism product. Now, the UK at present, if you look at the presentation, is under a lockdown. And the lockdown has shown that it has decreased significantly the number of coronavirus cases they are experiencing on a daily basis. Now, in the United Kingdom, if you look at the presentation with me, you see that the England is on lockdown until the 22nd of February, Scotland until the 1st of March, Wales until the 19th of February, and Northern Ireland just extended their lockdown until the 5th of March. Now, what are the lockdown rules? And it's important for us to understand these things because we have been advocating against going back into any lockdown. So the lockdown rules in the UK, they are saying, hey, stay at home. For only essential workers will leave, only for essential services you will be allowed to leave your home. Again, exercising outdoors, that is restricted. Going to schools are closed. So we have gone to online educational classes. No household mixing, indoors or outdoors, unless you support unless in your support or childcare bubble. So you know we have been creating bubbles and talking about these bubbles. No essential shops, leisures and entertainment. Pubs and restaurants have been closed. In St. Kitts and Nevis, we have been enjoying life to some sort of normalcy by having all these things that have been in lockdown in the UK opened. Now, I want to highlight, as per the presentation, what the lockdown has done in the United Kingdom, which is critical, is encouraging. If you look at the total deaths, what they're experiencing, for the last 2 months, it has been trending down. That's encouraging. The total cases has been trending downwards as well. And if you look at the number of persons in hospitals, that too has been trending. And what has been trending up though, which is critically to highlight, is the vaccination program. So you are looking at over 14 million persons in the UK have been vaccinated. So it shows that the vaccination program is rather successful. So again, if you look at the rollout, the UK rollout, the 15 million persons in the UK have received at least one dose of the coronavirus vaccine, and they are using both the Pfizer and the AstraZeneca, as mentioned by the doctors previously. The speedy rollout, which is critical, the speedy rollout of the vaccine to all vulnerable people is seen as critical to reducing the pandemic. So we have to move as well here in St. Kitts and Nevis with speed. It's critical if we want to reach a state of normalcy and achieve the goal of herd immunity. It says that from spring, the government of the UK plans to vaccinate the rest of the population, some 21 million people. In St. Kitts, the CMO just outlined how the groups and stages will go in terms of vaccination. Now, if you look at this slide, you will see that the vaccination process started a bit slow. However, you have seen that in the last 2 months, that's January and February, you have seen a significant increase in the vaccination process, if you take a look at the slide. So people getting vaccinated is one of the critical ways in which we will reach an end to this pandemic. So if we look at doses per country in the next slide, please. Right. You will hear the stories of Israel. According to the BBC, the Israel, United Arab Emirates, the UK, and the US are the 4 top countries rolling out the vaccination process. So vaccine doses per every 100 persons in these countries are the highest. In St. Kitts and Nevis, we want to achieve the goal of being one of the highest and the fastest vaccinating countries in the OECS. And I think we can achieve that. We have achieved much, and we can continue to achieve more. I want to highlight what the Health Secretary of the Office of National Statistics in the UK would have said. He said that the figures were clearly good news, but pointed out that there were still more than 24,000 people in hospital with COVID-19. He further said that everyone can have confidence that the plan is working, that we are collectively doing, what we collectively are doing is having a positive impact, but there is still a long way to go. The UK senior statistician, Sarah Croft, said the rates of infections remains high, but have continued to decrease in England and across the UK. So one of our source markets, such as the United Kingdom, is doing a lot in order for them to reach an end to the pandemic. We here in St. Kitts and Nevis, in particular, our people working in that particular sector, and being a country that relies on tourism, we need to exercise that level of responsibility as well, and feel encouraged, as they are doing in the UK, to also take the vaccine and do what we need to do to bring an end to this pandemic. Now, I want to move over to the United States. In the United States, they have seen a downward trend in death from COVID-19, as well as cases in COVID-19. In the month of December and January, there was a high spike in cases, and these are cold months. However, the new president would have introduced a 100-day mask wearing mandate, as well as a ramp-up of the vaccination process. What has been the result? A significant downward trend in cases per day and death per day that is being experienced. So therefore, doing these things has proven that in our source markets, the cases and deaths are trending downwards. So I want to highlight 3 particular states, and that is in the northeast of the United States and in the south. Let's take a look at New York City. In New York, 3 weeks ago, they were experiencing 12,859 cases per day. 2 weeks ago, the trend was 11,152. Last week, it has gone down to 8,670. And this week, we have seen that it continues to decrease to 7,949. So this is critically important. Let's look at Florida, Miami. Most of us travel to Miami for vacation and everything else. So 3 weeks ago, Miami, Florida was experiencing 11,338. 2 weeks ago, 9,982. Last week, 7,586. This week, it has trended downwards to 6,649. What does that mean? That all these measures that are being put in place have been working in order to decrease the cases. Dr. Rochelle Walensky, the director for the Center for Disease Control and Prevention, said on NBC's Meet the Press on February the 15th, it's encouraging to see these trends coming down, but they are coming down from an extraordinarily high place. All of it really wraps up into all of it is really wrapped up into we can't let our guards down, Walensky said. We have to continue wearing masks. We have to continue with our current mitigation measures. We have to continue getting vaccinated as soon as that vaccine is available to us. The vaccines are becoming available to us here in St. Kitts and Nevis, and we need to take the vaccine. So what happens when an outbreak of COVID-19 occurs? And I am going to make comparison to two Caribbean islands, Antigua and Barbuda and Barbados. Barbados is presently on a lockdown, and Barbados has experienced, or will be experiencing, according to the Honorable Mia Mottley, Prime Minister for Barbados, a $150 million in loss to the economy. And so these figures are very important for we to understand that we have to continue with the measures that are in place in order for us to reach that state whereby the vaccine can help us to reach a state of normalcy. Let's take a look at Antigua and Barbuda, who has gone, as of yesterday, into a state of emergency with curfews from 6 p.m. to 5 a.m. in the morning. Now, they have 270 active cases. 270 active cases and increasing on a daily basis. And they would have had to now slow the transmission of the virus by putting restrictive measures in place to ensure that they curb this transmission. So, what have they done? State of emergency, curfew imposed, and here we see the Royal Antigua and Barbuda Police Force encouraging persons that we can do this. In St. Kitts, we don't need to do this. We need to ensure that we keep the gains that we have made. So how do we mitigate the impact of COVID-19? We have to continue with the public health campaigns, increase the knowledge about transmission, the treatment and the vaccine that we are going to be we have accessed some, and those that we'll be accessing, and continuing to the adherence to non-pharmaceutical measures. How do we bring the end game to the COVID-19 pandemic? And this image, as you see in the presentation, you see an individual here taking his vaccine. Still, after he takes his vaccine, he continues with his social and physical distancing, wearing his mask, and continuing hand hygiene and all other hygiene measures. It's important for us here in St. Kitts and Nevis to adapt to what is needed in order for us to reach that herd immunity needed. Please feel encouraged. I am also one of the candidates to take the AstraZeneca, even though I prefer the Pfizer, but the AstraZeneca is just as good for me. That's why we tell you why the Pfizer. It's a preference. Thank you, Mr. Williams.